Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites umedicaldoubts.blogspot.com and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary for the medical knowledge to general people and for reference to medicos. Today I am going to discuss about the heart block. Heart block is a condition in which the electrical impulses fail to travel normally in the path of atrium, IV interventricular septum and ventricles and causes symptoms. The heart block may be slight and reflected only in prolongation of PR interval of electrocardiogram. The block may be moderate with the impaired conduction of the impulses from atria results in some dropped ventricular beats. It also may be so great that the ventricles adopt an independent rhythm. Sinoatrial block, SA block. In the SA block, a complete cycle is missed, hence causing a gap in the pulse. It is of little clinical importance and is rare. It occurs due to increased vagal tone. Electrocardiogram. ECG shows both atrial and ventricular complexes are absent. Atrioventricular block or AV block. Conduction between the atria and ventricles is impaired. Delayed AV conduction, first degree block. PR interval is prolonged beyond the normal, that is 0.2 seconds. Partial heart block, second degree block. Some impulses from the atria fail to reach the ventricles, means dropped beats occurs. Sometimes there is a progressive lengthening of successive PR intervals followed by dropped beats. Wenck-Bach's phenomenon. Complete heart block. From atrium, no impulses reach the ventricles. The ventricles beat at their intrinsic rate of about 40 beats per minute. The depression of conduction is most commonly due to ischemia, fibrosis or inflammation of bundle of His or vagal stimulation. The diseases may be coronary artery disease, focal fibrosis, rheumatic fever, digitalis, aortic stenosis, congenital heart disease, disorders of atrial rhythm and cardiomyopathies and myocarditis. Clinical features. Delayed AV conduction can be diagnosed only by electrocardiogram. It helps for the diagnosis of rheumatic carditis. Partial heart block. When the atrial and ventricular contractions have a simple ratio of 2:1 or 3:1 block, the pulse is slow and regular. Change in the degree of partial heart block may give rise to sudden changes to pulse rate. The degree of block may be diagnosed by comparing the number of atrial contractions, that is a wave in the jugular pulse, with the carotid pulse. 3:2 and 4:3 blocks may give rise to dropped beats. On auscultation, it can be appreciated that there has been ventricular beat, thus distinguishing the condition from the ectopic beats. The first heart sound may vary from intensity. Wenck-Bach's phenomena is due to progressive fatigue of the AV bundle with recovery following the rest period. When the dropped beat occurs, partial heart block is transient and may occur during an acute infection, overdose of digitalis or coronary heart disease. Complete heart block. Complete heart block is characterized by the slow pulse rate 30 to 40, regular and not altered with exercise. There is complete dissociation between the jugular A wave, and the carotid pulse. There may be varying intensity of first heart sound and audible atrial sounds. Venous canal waves in the neck may be seen when the atrium contracts against a closed tricuspid valve. Adams-Stroke syndrome, when cerebral blood flow ceases as a result of ventricular asystole, tachycardia, fibrillation, or syncope occurs rapidly. Convulsions may occur if the heart does not begin to beat again within 10 seconds, and death may result if asystole is prolonged for more than 2 minutes. The skin blanches and then cyanosis occurs. When the heart starts beating again, there is characteristic flush as the emptied vessels are filled with blood. The syndrome is a complication of complete heart block or less commonly partial heart block. Patients' repeated attacks may be aware of the immense of the unconsciousness, but frequently syncope occurs without warning. Breathing may continue after the heart has stopped. Treatment. Adams-Stokes attacks are self-limiting, but if not, may be terminated by a blow on the pericardium, closed chest massage, electrical pacing of the heart. Complete heart block in acute myocardial infarction requires treatment to prevent undue bradycardia or asystole. Isoprenaline as an intravenous infusion 1 to 5 milligrams in 500 ml dextrose is effective in increasing the ventricular rate. Electrical pacing may be carried out by advancing a special electrode from a peripheral vein till its tip lies against the endocardium of the right ventricle. Its external end is attached to a pulse generator. Pacing is usually required for only few days. Treatment by drugs or pacing is also required if chronic heart block leads to heart failure or Adams-Stokes attack. Long-acting isoprenaline may be given at a dose of 30 milligrams or more 4 times daily. As an alternative, pulse generator may be permanently placed beneath the skin and electrical pacing instituted. Prognosis, as it appears, is serious but depends upon the cause. The myocardial infarction, the block is transient. In chronic heart block with effective pacemaking, it is good. Bundle branch block. This term is applied to the block in the conducting system in either right or left branch of the AB bundle, mostly due to coronary artery disease. Rheumatic heart disease and congenital heart disease may sometimes cause the condition. Sometimes there may be no evidence of underlying disease. Diagnosis. Diagnosis may be made by means of electrocardiogram. The QRS interval is increased to 0.12 seconds. The clinical manifestations, treatment and prognosis are those of the underlying disease. That's all about the heart block, and in the next video I will discuss about some other disease. Thank you.